Okay, well, good evening and welcome everyone. Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckbill, and today I will be serving as your program facilitator. I will help present your questions about the signs, symptoms, and treatment options available for men suffering from heart disease and related conditions. We will also discuss common health issues men face and how heart health and prevention can help, as well as the importance of not delaying care during the COVID-19 pandemic. Today, we are joined by two physicians, Dr. Alexander Spillman, cardiovascular disease, advanced heart failure, and transplant cardiology, as well as Dr. Perry Weiner, director of Men's Health Program, Urologic Oncology, and Urology. Well, thank you so much for submitting your questions in advance. We have a lot to get through tonight. And if you have any questions throughout the discussion tonight, for those joining us on their computer or tablet, at the bottom of your screen, you will see an icon that says Q&A. If you don't see it, maybe just try moving your mouse around a bit and it should appear. So go ahead and please select that Q&A icon and you can enter your question in the text box. Your questions are not public. They will only be seen by myself and our panelists. Since this is a sensitive topic, when you submit your questions, you have the option to submit anonymously. And for those joining us by telephone, if able, please go ahead and email any questions to marketingevents@jefferson.edu. And we'll do our very best to get to as many questions as possible, but may not be able to answer all of them during tonight's virtual event. And of course, due to hospital university guidelines and privacy, we are unable to comment on specific cases or the number of patients we have treated or are currently treating. Likewise, if you are experiencing any symptoms that may require medical attention, please consult a medical professional. Finally, don't worry, we've taken the liberty of muting everyone's line to eliminate any annoying background noise, so feel free to move around and get comfortable. So with that, I want to give each of our physicians a minute to say hello, let us know how you're doing, and then we'll move into our submitted questions for the evening. So Dr. Spillman, we'll start with you. How are you doing?
Thank you, Sarah. I'm doing well, and thank you all for joining tonight's webinar. I'm happy to be here with my Jefferson colleague, Dr. Perry Weiner. This is a great opportunity to talk about men's heart and general health. I'm really looking forward to our conversation tonight.
Yes, thank you so much. And to that, welcome, Dr. Weiner. How are you doing?
I'm fine, thank you, and I appreciate the opportunity to participate tonight. I'm looking forward also to helping educate people about the importance of early intervention and prevention for any medical problems related to heart health and genitourinary health. We'll also explore the connection between the two sometime during the discussion tonight.
Okay, perfect. Thank you. And, thank you for that reminder to not delay care, especially during this pandemic. So with that, let's go ahead and jump into the questions that were submitted. So Dr. Spillman, we'll start with you for our first question tonight. Can you explain what blood work is important to check and what other values your provider is looking for when they're evaluating your cardiovascular health? And along with that, maybe just a few basic components of cardiovascular health that you might be worried about.
Sure, thank you so much. So just as heart disease and atherosclerosis is a lifelong condition, prevention is a lifelong process. We know from multiple studies that cholesterol formation starts actually before birth. So it's very important to start prevention before birth, and that's where maternal fetal medicine and OBGYNs get involved. But once you are an adult, and you go to your provider, whether it's a primary care physician or a cardiology office, there are a couple of things that we are screening for and looking for to prevent events further in life. The visit starts with measuring your weight and blood pressure. Blood pressure is very important because it's a major predictor for heart attack and stroke. It can be silent. People don't feel their blood pressure being elevated a lot of times. Once that part is over, the physical exam part is, listening to the heart to make sure there are no extra sound or noises or skip beats. An astute clinician can sometimes find evidence of heart damage or plaque formation in the pupils or in the toes or hands. We can also see changes related to high blood pressure in the exam of the eye. Unfortunately, that's becoming a lost art. And after that, we combine that, and there are multiple ways of looking at the overall risk of developing heart disease, depending on your age and phase in life. So there are multiple scores. The most famous one is probably Framingham score that takes into account your age, your sex, family history of heart disease, whether somebody in your immediate family had a heart attack or stroke before the age of 60, looking at the blood pressure, and finally looking at your cholesterol and whether or not you have diabetes. Depending on what that risk profile shows, that helps us tailor the best recommendation for you for your stage in life. So we want to prevent events, but not everybody has the same risk. So our approach will vary depend on that.
Okay. Great. Well, thank you so much for that helpful information. And I think just as a quick follow-up there, a very simple but important question to ask, how does cholesterol impact heart health?
Sure. So, and cholesterol is a main component of what we check for really at every stage in life. The first time you're supposed to have your cholesterol checked is actually at the age of 9 to screen for hereditary causes of high cholesterol. But after that, we check regularly, and depending again on your risk, we decide whether or not you need medication. The cholesterol profile, or otherwise we call it lipid profile, is a set of numbers that you get. There is a total cholesterol, that's all the particles that in your blood that you have. And then you may have heard about high density lipoprotein, or HDL, that's good cholesterol, that's protective. There is bad cholesterol, LDL, which we know increases the risk of heart disease, heart attacks, and strokes. And there's triglycerides that's usually related to diet, although there are some hereditary components to that as well. Depending on what the numbers and the ratios are, we again tailor the approach, and with either lifestyle and diet changes or medications.
Okay. Well, thank you. Very helpful indeed for both of those questions. All right. Well, let's go ahead and switch to Dr. Weiner. Dr. Weiner, a question for you. Why is it so important for a man to see a urologist, especially as he gets older? Oh, and I think you might be on mute. I know, the fun of Zoom.
Great. Thanks so much. I appreciate that. The importance of seeing a urologist is we try to focus, at least in our practice, we try to focus on prevention. Men tend to be reactive rather than proactive. So the advantage of seeing the urologist early on is to help diagnose problems which often in the urinary tract are silent until, sadly, sometimes it's a little too late. Men who have, for example, heart disease might experience chest pain, as Dr. Spillman was alluded to. Perhaps when they exercise, they become short of breath, or they get pain in their legs, signs of blood vessel insufficiency. In men, however, we don't really have that ability in the urinary tract. The thing that we're most concerned about these days, of course, is prostate cancer. So the blood test for that is the PSA test, which I'll touch on. PSA is a protein produced by prostate tissue, and it is something which all men who have prostate tissue in the body will be able to detect with the blood test. Having an elevated PSA doesn't mean that there is cancer. Having a low PSA, on the other hand, doesn't mean that there's not cancer. It's relative risk. The higher the number, the trending of the number is important, and these are some of the things that we look at in combination with a physical examination to help detect prostate cancer. Prostate cancer can be cured when it's found very, very early, which is the reason why it's important to see a health professional and have the prostate examined in addition to the blood work so that we can hopefully find this problem when it happens early on. In terms of other medical issues that people need to be seen for, well, I did say that we don't have a lot of symptoms in the urinary tract. which are predictors of future disease. I wasn't telling the entire truth, and that is because the blood vessels that supply certain parts of our body, particularly penis for erection function, can be a very early warning sign for future cardiovascular disease. So a man who's having some difficulty with erections, because the blood vessels that supply that organ are quite small compared to the blood vessels that go, let's say, to our heart or to our brain or to our lungs, those blood vessels can become clogged and obstructed earlier on than the other blood vessels in other parts of the body. So the first warning sign of future heart disease has been shown to be, in some men, difficulty obtaining or maintaining an erection. So these are some of the reasons why it's very important for people who have these symptoms to visit a physician as soon as possible.
Okay, thank you. And thank you so much for bringing that up, because that goes right into our next question. So if a patient perhaps improves habits like diet and exercise, could that really have a positive impact on sexual function?
Absolutely. And I think that that's something what we need to underscore for most people is that our health is ongoing, and everything we can do to decrease the risk of ongoing issues will improve our health as we age. So, for example, smoking. The drug nicotine, which is in tobacco, is a very, very powerful drug in terms of how it acts on blood vessels. And people who smoke or who have ever tried a cigarette, remember the first two things that happened were dizziness and coughing. And that's because there's insufficient blood flow, and blood carries oxygen. Tissue needs oxygen for normal function. So a patient who's smoking has their blood vessels in a constant state of narrowing, which impedes blood flow to vital organs. That can lead to heart disease. That leads to also difficulty with erection, because all of these things rely on adequate blood flow.
Really interesting how it's so interconnected. Well, thank you so much, Dr. Wiener. Now, Dr. Spielman, along the lines of prevention, question for you: what small changes can be made in a diet to improve overall heart health? And can you talk a little bit about physical activity improving overall heart health for men at different ages?
Sure. So a lot of prevention, of course, is diet and exercise and small changes. And even small changes in your lifestyle can lead to big changes in your life. So just because you can't follow the guidelines or recommendations to a T doesn't mean you should give up and not do it at all. But in general, we recommend 30 minutes of exercise a day. So 150 minutes of 30 minutes of exercise a day of general exercise, or 75 minutes a week if it's vigorous exercise. But if you're not able to do it, any amount of exercise in increments of at least 10 minutes, so that your heart, so that your pulse quickens and you get short of breath and a little bit sweaty, is good. As far as dietary changes, we recommend healthy eating, which changes every 5 years, it seems, right? Because we were talking about how you can't have eggs, and now you can have eggs. It seems that simple sugars, carbohydrates, are not good, right? And trans fats are not good. So we recommend diet and lean proteins and green vegetables, fruits, and less simple carbohydrates and processed foods.
Okay, thank you. Just kind of like those small lifestyle changes can really make a big impact. So appreciate that helpful information. Okay, turning back to you, Dr. Wiener. Question: how is the heart related to other conditions like prostate health, a healthy bladder, and healthy sexual function?
Great question. Thank you. So the heart obviously supplies blood to all vital parts of the body. I'm not sure that the bladder is involved in that so much, but really the heart relates mostly, and what we're going to focus on for this discussion, again, is sexual function. So I would say that if the patient has the ability to maintain good blood flow, that is very important. That is that is the fundamental reason that we're able to participate with sexual activity. So to Dr. Spillman's point, patients who have healthier lifestyles in terms of no tobacco, a diet that is low in fat, high in vegetables and fruit, and lean protein. These are the patients who also tend to exercise a little bit more, which is important because that improves blood flow to all vital organs. It improves blood flow to muscle tissue, and it helps build up muscle strength, but it also improves general circulation, which is important for overall body health.
Okay, thank you so much. All right, turning it back to you, Dr. Spillman, a question we received from the audience about heart condition. If I've been diagnosed with a valvular heart condition, what are my next steps and who can help me?
Sure. So if you've been diagnosed with a valve condition, that's, I'm presuming that in the year 2022, you probably had an echocardiogram, so you already had a first interaction with a heart team. But sometimes we diagnose valve conditions by listening to the chest and hearing a murmur, or eliciting complaints such as, or people coming in with complaints of shortness of breath, severe fatigue, or leg swelling. Depending on what kind of valve condition it is and how severe it is, sometimes the options are do nothing. Our technology right now is so good that actually 80% of people, when they have an echocardiogram, have at least one valve that's reported as mildly leaky, and that's usually completely benign and meaningless. It's just the technology is so good that it picks up things that we weren't able to pick up 40 years ago. But if you have more than a mild valve disorder, whether it's stenosis, meaning the valve doesn't open well, or leaking, called regurgitation, then you would see a heart doctor, a cardiologist, who will either follow you for progression for symptoms such as I described, or sometimes we follow you with serial echocardiograms every so often, usually every year or every several years, depending on how severe the valve condition is. And we monitor for changes in your heart function to prevent those symptoms from occurring. If your valve condition is to the point that it is severe, whether you have symptoms or your heart already shows signs of hurting, it's getting bigger, it can't pump as hard, the walls are getting thicker, then it's time to get evaluated for intervention, whether that's a replacement or repair. Sometimes we will send you to a heart surgeon, depending on your age and other medical conditions you may have. More and more, we function as a heart team comprised of a general cardiologist, a person who does a lot of imaging with CAT scans and echocardiograms to look at your valve more closely, a heart surgeon, and an interventional cardiologist who specializes in valve interventions, called structural interventional cardiologist, to come up with the best way of dealing with your valve condition and offering you the best solution to get you back to your quality of life.
Okay, thank you. A lot of critical information there. So appreciate you running through that. A follow-up question, can you maybe tell everyone, just with all that information, why it's so important to build a really strong relationship with a cardiologist, especially as men get older?
Right. So, prevention is a lifelong process. So depending on your stage in life, we're going to look at you differently, right? So at early, before you're 18, it's all about diet and exercise and building healthy habits. As we progress, there is more focus on checking those numbers that we talked about, your blood pressure, your cholesterol, recommending lifestyle and diet changes. And as we get older, we have to use strong interventions such as medications to keep those from progressing. I've had patients tell me that back in the days, the normal blood pressure was considered your age plus 100. So, but we don't do that anymore because we know that by lowering that number, we can prevent strokes and heart attacks. So it's very important, depending on what your stage in life, it's very important to keep that relationship.
Okay, perfect. Thank you so much. And one more question for you. What options does Jefferson offer men for heart health care and overall health?
Right. So we are a system of 18 hospitals now throughout the region. We have all aspects of cardiovascular health, from prevention to the most advanced heart surgeries, robotic surgery, aortic program, transplant, and left ventricular assist device program. We have a partnership with Nemours for congenital heart disease. So if you, so we can help you and or help you lead your healthiest life at any stage, at any point, whether you need to stay healthy or if you have family history and you want to prevent an event, or if you have a serious heart condition. We have best trained specialists at all those locations. So while not every hospital will offer the most advanced surgeries, you will get the expertise that is the same across the system, and we'll be able to help you find the right specialist at the right place.
Thank you so much. And Dr. Wiener, I'll turn that question to you as well. Is there anything you want to add about Jefferson and overall men's health and general care?
Thank you. Yeah, we have a men's health program at Jefferson, which encompasses all specialties which relate to men's health. So it's under the umbrella of urology, but we also encompass cardiovascular disease, endocrinology for the patients who have diabetes, thyroid disease, and other endocrinology problems. We have people who specialize in sleep medicine, family medicine, and primary care, as well as sports medicine. So we're able to address all of these aspects of men's health generally in one location, which is located at the Navy Yard, and we're able to address each men's problem individually. So we all work together, we communicate about each patient individually, and we're able to come up with treatment plans to maximize each individual's needs depending on why they see us.
Okay, terrific. Well, thank you. And before we head into some live questions from the audience, I would like to ask each of you my favorite question. What are your goals for patients seeking cardiology, urologic, and general men's health care? And what do you want our viewers to take away from this webinar? And Dr. Spielman, I'll start with you.
Sure. So, we have to, it's a lifelong process, and we want to help you get the longest, healthiest life. If you smoke, please stop. It's, we can't emphasize that enough. It's bad for your heart health. It's bad for your brain health. It increases your risk of urologic problems, as Dr. Wiener can talk about. But in general, so when we talk about heart, a lot of times we talk about blockages. And if you think about heart as a house, there are walls and the doors, and that's your valves and the walls of the heart, and there is plumbing and electricity. So we do talk about plumbing a lot, and that's very important. That's where we talk about cholesterol buildup and heart attacks and stents. The electrical part is very important. Sometimes we can pick up an abnormality with electrocardiogram or by listening to your heart. People feel heart racing sometimes, and that can be a sign. There is a lot of interest in wearable technology, actually, from Apple Watch, that has been helpful in detecting some rhythm abnormalities that we do know increase the risk of stroke. So it's going to be very interesting. There may be some interesting changes on the horizon, but if you're generally healthy and you don't smoke, the best thing to prevent heart disease is to keep a healthy lifestyle, exercise regularly, avoid simple carbohydrates and trans fats. When you go grocery shopping, shop on the periphery, don't go into the aisles. Try to buy food that looks like it grew somewhere or was at some pasture at some point, and watch for subtle cues. As we know, sometimes it's sometimes leg numbness or hair loss in the legs can be a sign of heart problems. Sometimes erectile dysfunction can be a sign of cardiovascular problem, heart problem. And that's where it's all very important to talk to your team and not be embarrassed and ask questions, because a lot of times we can prevent serious events.
Thank you so much. And really like that analogy of the grocery store going, not going through the aisles. I think I'm going to keep that in mind for my next grocery store trip. So thank you. Okay, we'll turn it to you, Dr. Weiner. Any other comments?
One of the things I frequently hear from my patients, particularly because I deal with men and men who are in their 40s, 50s and older, I hear things about, I'm getting up at night, or I'm having difficulty urinating, or I'm having difficulty with sex, but I'm older, it's normal. And these are not normal things. Yes, the prostate enlarges as we get older. Yes, prostate enlargement is problematic, but getting up 2, 3, 4 times at night, having to rush to the bathroom, sometimes perhaps having an accident, these are not normal things. And men tend to just shrug this off by saying, I'm getting older. I'm having difficulty, but I expect it. These are not natural and expected things at this time in our lives. These are things which we can focus on. These are things which we can improve, because it's about quality of life. I think the most important thing is to educate people. And part of that education is to overcome fear. I think that men often tell me that they can't get things done. They're too busy. They're working too hard. Their family relies on them. Perhaps they can't take time off from work. These are important things that we all deal with because we feel responsible. We feel responsible to our family, and we want to do a good job. But I encourage people not to delay their health and not to delay intervention, because if there is a serious problem, then the loss of time from work and other issues which may occur as a result of not addressing the problems early would take you out of circulation sooner than you want to. And then everybody who really relies on you is in a lot of trouble. So as I mentioned before, we need to do a better job of focusing on prevention rather than repair. We need to make time for ourselves, and we need to understand that some of the things that we experience as we age are not necessarily acceptable, and they need to be treated, if for not any other reason than having worked so hard for so many years, as most people do. We deserve a little health and enjoyment as we get older.
Absolutely. Thank you so much for that profound message. I think that will really resonate with a lot of people tonight, knowing that, it doesn't have to be your normal. So thank you. And with that, I'm excited to head into our live questions for tonight. So let's just kick things off. We have been receiving quite a few. So Dr. Shpilman, we'll start with you. What is the life expectancy of a traditional open heart surgery patient if they have no complications?
Right. So I think that's a very good question. I think it depends on what is the age of the patient when they have the open heart surgery. But there have been studies of watching people who've had bypass surgery and seeing how they did. And actually more than 90% were alive in 5 years, and about 75 to 80% in 10 years, and about 40% in 20 years. So that's those are the numbers. As far as if the question is how well the bypass grafts or the valves are doing, that's a little bit different. That depends on the type of valve and the type of a bypass that you've had. When surgeons use arteries for bypass surgery, those are much sturdier because arteries are used to withholding that kind of pressure. Veins tend to stop working after some time. About half are not functioning well after about 10 years. But your survival is really pretty good after heart surgery.
Okay. Thank you so much. That was really helpful. And Dr. Spillman, I'm not done with you. We have another question from the audience. I was diagnosed with an ascending aortic aneurysm and have a family history of aortic aneurysm from my father's side. How often should I have follow-up CT scans performed? And at what point should I see a surgeon?
So that is a very good question, and I'm going to be very general here because that really depends on your history, on the family history, on how tall are you. So 5 centimeters for a 6'4" person is different than 5 centimeters for a 5'4" person. But if you have just been diagnosed with an aneurysm and it's already around 5 centimeters, I would actually get in touch with an aortic program now. And at this time, so at Jefferson, we have Dr. Plestis, who is an internationally known aortic surgeon. And we have an aortic program that can help you make those decisions. Sometimes we get another CAT scan in about 6 months to see, and if the growth is not rapid, we can do it every year or so. But when it gets about 5 centimeters, that's actually the time when we start talking about surgery, assuming you have no other major medical conditions. Also depends on whether you were born with a valve that has 3 leaflets or 2 leaflets. If you have a valve that's called bicuspid aortic valve, the time to do surgery is earlier. If you have an aortic disorder, or if you were born with something called Ehlers-Danlos or Marfan syndrome, those the triggers for surgery are much, much lower. So if this is your first CAT scan and you just found out that you have an aneurysm that's about 5 centimeters, the time to see the aortic team is actually now.
Okay. Thank you so much. Now for both doctors, so either of you can take this. What are the pros and cons of calcium scoring screening? And is there a direct link between erectile dysfunction and calcified coronary arteries?
So I'll take the second part of the question, if I may.
Yes.
I believe that if, as we mentioned before, vascular disease, atherogenic disease is, as Dr. Spillman mentioned, it's a body-wide issue. It's less common, I believe, for people to have focal or isolated issues with blood vessel insufficiency. If somebody's going to have generalized atherosclerotic disease in their heart, they likely have it in their neck or the carotid arteries, which leads to stroke. Perhaps these patients have decreased ability to walk distances, so the arteries that lead to their legs are narrowed and don't often give enough blood flow. And similarly, the blood vessels that lead to other vital organs, including our genitals, are similarly affected.
Okay.
And I can take the first part of the of this question. So calcium score is a very common tool we use to help you hone down on your risk of heart disease. What it does, it's a no contrast, so single breath hold. You come in, it literally takes 10 seconds. You don't need to get an IV, and it's a low dose radiation to look at the buildup of calcification in your coronary arteries. And the computer algorithm calculates the score. 0 is means you have no calcium. Above 400, there is a very high correlation between the score above 400 and having a blockage that's actually obstructing the blood flow to the heart artery. And everything in between is in between. But there are a few caveats. If you are young, if you're younger than 40, you probably haven't had a chance to build up calcium. That doesn't mean you have no risk. You could have soft plaque. So it's too early to get it. If you already have had an event such as a mini stroke, heart attack, or if you had a stent, it's too late to get a calcium score because we already know you have heart disease and we need to treat you aggressively. So it's really for a person who has some risk, and we want to help you identify that risk, whether we treat you very aggressively or whether we can watch you, because if your score is very low, 0, ideally, the 5-year risk of having a heart attack is actually almost non-existent. So it's you can take that to the bank.
Wow. Some great information. Thank you. These are great questions, so keep them coming. Okay, another question for you, Dr. Weiner. Prostate health recommendations are hard to follow. Can you comment on the U.S. Preventative Task Force recommendations? I have not had a digital exam, and my doctor said it's not recommended.
I would respectfully disagree with your physician. The U.S. Public Health, the U.S. Health, the task force, some years ago, came out with recommendations which talked against PSA. However, their results and their recommendations were actually reversed a couple of years later. The position of the American Urologic Association, as well as other professional organizations in medicine, disagreed with that and came out with information that showed the studies that they relied on to make their recommendations were faulty. Additionally, as a result of that task force, people started to have less screening. Before that, we saw the number of patients who died of prostate cancer decrease. When they came out with their recommendations in the ensuing years, the number increased because people took what they said erroneously. And then when we started to recommend PSA screening again, the numbers have started to fall as they did before. So the recommendations for the task force are no longer in effect, and we recommend this. If you're of African American descent with family history of prostate cancer, annual examination and PSA testing start at the age of 40. If you have no family history, it's 45. If you're not African American with a family history, it's 45. And if you have no family history, it's 50. Rectal examinations are important because, as I mentioned before, PSA is not the end all and the be all. It's a great screening test. It's probably the most sensitive biomarker in our body. However, not all cancers produce PSA, and there are other abnormalities that are detected by doing a rectal examination, not the least of which is anal and rectal cancer, which are often found by the urologist. So there are a lot of issues which are brought out by a thorough physical examination. Current recommendations include annual PSA testing and rectal examination.
Okay, thank you so much. That is some incredibly valuable information there. Really appreciate you sharing that. Okay, continuing, Dr. Spielman, we have an interesting question for you. If I'm over 70, will changing my diet to a more plant-based diet have a positive impact? And also, how much should someone over the age of 70 be walking each day?
Sure. So that is a great question, and it's never too late to change your lifestyle or change your diet. I think going to a plant-based diet that has a lot of advantages. We certainly know that people who have plant-based or not meat-eating diets oftentimes have lower risk of heart disease. When you do that, you just want to make sure that by replacing meat protein, that you don't replace meat protein with sugar, that it's replaced by plant-based protein and plant-based fats. But otherwise, I think it probably will have a good impact on your health. And as far as exercise, we do recommend 150 minutes per week of exercise for anybody, and or 75 minutes per week of vigorous exercise. There is no age cutoff. If you can do it, that's great.
Awesome. The great thing about exercise, something as simple as a walk can have such a positive impact. So that's great to hear. Okay, another question for you, Dr. Spillman, is taking an aspirin daily still recommended for certain patients? And if so, which?
Sure. So that is a very important question. And I get asked that a lot, because if you look at, or if you go to a provider who was practicing 20 or 30 years ago, you may get a different recommendation, and people have fistfights about how much aspirin and whether you should have it. So the simple answer, if you've had a stroke, mini stroke, or heart event, meaning a heart attack or a stent placed, you should be on at least a baby aspirin indefinitely. There are some situations when that can be modified. Almost nobody should be on a full dose aspirin, and just nobody should be on full dose aspirin unless you have a very specific conversation with your physician about it. If you have not had any of those events, that's where the story gets very murky. There was a recommendation that if you're over 50 and if you've had diabetes, you're considered just as much of a risk of heart disease as if you've had heart disease, so you should be on aspirin. And most recently, we walked away from that. So at this point, if you have not had any of those events that I talked about, in general, we do not recommend baby aspirin. Now, you should still talk to your provider about that. And there are a couple of reasons for that. I think the biggest reason is, there is information, and even though aspirin is a very old medication, but we are never done learning about it. So some reason for that, for the change in that recommendation, is because the older studies that led to the recommendation of a baby aspirin for prophylaxis, for prevention, did not take bleeding into account as much. And now we know that even a baby aspirin can increase risk of significant bleeding from the lining of the stomach to even bleeding in your brain. And the other reason is that in the last 10 years, we got much more aggressive about treating blood pressure and cholesterol numbers. So we address the risk in a different way. So that may be the one of the reasons why the benefit of the aspirin at this point is not as high as it was 20 years ago or 10 years ago.
Okay, some great information and just interesting to hear those updates. So thank you for sharing. Another question for you, and then I promise we'll turn to Dr. Weiner, but a question from the audience. What is the meaning of ejection fraction percentage? And can a patient with congestive heart failure improve that number?
Sure. So now we're switching from the plumbing to the house. So the heart squeezes to get the blood out, and then it relaxes to let the blood fill it before the next cycle. The percentage of that contraction that we can estimate by multiple ways, usually by echocardiogram, but sometimes by MRI or other techniques, is called the ejection fraction. We know that the lower it is, once it's below 50, so 55 to 75% is normal. The heart is not a dish rag, you're not going to get 100. So 55 to 75 is normal. Less than 50 is abnormal. And we know that with every 5 or 10% decrease is correlated with worse prognosis, worse survival. We have, for people who have low ejection fraction, below 50%, we now have decades of information and very good medications to treat it. So if you're in that group, you should be on in general, a cocktail of 3 or 4 medications that do improve your ejection fraction. If that doesn't work, there are multiple ways we go forward. Sometimes we recommend a pacemaker or defibrillator, or a more specialized type of combined pacemaker defibrillator. But yes, you can stabilize or improve your ejection fraction with medical therapy, as well as addressing other things as other risk factors like obstructive sleep apnea and increasing exercise and watching your blood pressure and not using drugs and smoking, etc.
Okay, thank you so much. Next question, either of you can answer. Can the doctors comment on the impact of alcohol on cardiovascular and urologic health, and how much is appropriate as I age?
Good question. So Dr. Spillman will also weigh in on this. I know that there's a lot of information out there about how much is appropriate to drink and quantities, but generally we think that men should not consume more than 1 to 2 alcoholic beverages daily. There's a common wisdom out there that says wine is good for you and perhaps spirits aren't, but the bottom line is that a beer and a mixed drink and a glass of wine all have the same amount of alcohol. In terms of sexual function, it does cause a depressing effect. Although initially alcohol works by dilating or opening up blood vessels, that effect after more than a little bit is diminished, as opposed to the effects on our brain function and our ability to perform naturally. So I hope that answers the question succinctly.
And that same answer can be applied to heart as well. So the definitions of what is an alcoholic beverage, as Dr. Wiener explained, are the same. And there is, there is a correlation with slight decrease in risk with appropriate alcohol consumption, as Dr. Wiener mentioned, maybe a drink a day. But that is negated or even gets worsened if you are a heavy drinker. So if you drink significantly more regularly, that will increase your blood pressure. It will increase your, it will worsen your cholesterol numbers and lead to worsening heart health. And also important to remember that alcohol is sugar. So depending on how much you're drinking, that's actually, you might be taking in a lot of sugar.
Right. And just to add to that, from an endocrine perspective, people who drink large amounts of alcohol very often have low testosterone levels, because it causes, in the end, an increase in relative estrogen in the body. So consuming large amounts of alcohol, particularly over a period of time, can actually decrease our performance because the amount of testosterone in our system decreases.
Wow, really interesting. Again, just all of that interconnectedness, but sounds like a drink a day might be the best way to move forward. So thank you for that. Okay, let's continue. Dr. Wiener, we have a question for you. I have a large prostate and increasing PSA test score over the last 17 years. Is there such thing as too many biopsies? I've had 5 and I'm 64. How often should I be getting biopsied?
So without knowing the specifics of you and your physical examination, I would tell you my philosophy. It depends on the type of biopsy that you're having. At Jefferson, we use the latest technology, including MRI. And the idea behind MRI, particularly in patients with previously negative biopsies and continued concern for the possibility of prostate cancer, we perform an MRI in conjunction with prostate biopsy to help localize areas which may not be seen on a traditional ultrasound. We also look at prostate size. So if you think of the prostate like a little factory, and it produces PSA, which is a protein, And the prostate is a gland, and glands produce different substances. Salivary glands produce saliva, tear glands produce tears, prostate produces fluid as well. PSA is produced by the prostate. A prostate that's 30 grams or 30 cc's in size may not produce and likely won't produce as much PSA as a gland that's 60, 90, or 120 cc's. So there are some calculations that we do to correlate the PSA to the size of the prostate. Importantly, we like to follow PSA over time. I'm more concerned about a guy whose PSA is 1.5 last year and jumps to 3.2 this year, as opposed to a guy whose PSA is 4.1 to 4.5 over the same period of time. Yes, the guy with the other PSA should have had a biopsy as well, the fellow with the elevated PSA, but also it hasn't changed that much. So we look at the rate of change. And then, of course, we have to correlate it to your age. How old were you when you first started to have your PSAs done? Is there a family history? What did the previous pathologies show? Were the previous pathologies entirely benign, or were there some areas in the prostate which gave somebody concern for additional lookup? And lastly, there are some tests which we can do in addition to biopsy, where we do sophisticated molecular testing, DNA testing, and in some cases take old biopsy specimens and do what's called a DNA methylation test to look for areas which are at higher risk to develop cancer in the future.
Okay, thank you so much. Some great information there. And I think we're just about getting to our last live question of the evening. So Dr. Spielman, this is for you. Should I have a BPM or beats per minute goal for exercise and vigorous exercise? How would that be defined?
So I think, so we can define the exercise. So what we use is called METs, metabolic equivalents. So right now, all of us are enjoying some sedentary behavior. We're sitting or lying down, and that's 1 to 1.5 METs. Vigorous exercise is more than 6 metabolic equivalents, and that's jogging or running, biking, pushing yourself more than 10 miles an hour, playing singles tennis, swimming laps, something that really gets your heart going. As far as your goal heart rate, it really depends. I mean, if you're doing one of those vigorous exercise, your heart rate will go up. In general, and again, this is a very general observation, the heart rate that you can achieve when you're exercising is around 220 minus your age. If you have no heart problems and you have no limitations, there's really there is no particular goal to strive for when you're with your pulse. Certainly, if you've had a heart attack or a stent, if you're if you're following a cardiologist, then it's going to depend on what your particular condition is and what your goals are. And a lot of times, and this is actually very important and very underused tool in our tool belt, but people who have had heart conditions should really all be referred to cardiac rehab. It's highly recommended by all the societies, and unfortunately, there are some barriers. A lot of it is time consuming, or insurance copays, or the location of your closest cardiac rehab. But it's very, very important that if you've had an event and you're following with cardiologist, you should really consider going to cardiac rehab, where you can be observed getting back to vigorous exercise.
Okay. Well, thank you so much. We really appreciate it. Those were some terrific questions. So now that we're just about out of time, I do want to give each of you an opportunity for any final comments. Dr. Spielman, we'll go ahead and start with you and closing us out this evening.
Well, I want to thank everybody for joining the webinar tonight again. And thank you, Sarah, and thank you to the organizers. Thank you, Dr. Wiener. I think both of us made the point of not to delay screening or care, and especially in the time of pandemic when we're all stressed. Everybody has other things to do, but you only have one body and you have to take care of it. And no matter where you are in the spectrum of life and your health, consider seeing a provider regularly to assess your risk for heart disease and vascular disease and act appropriately.
Okay, thank you so much. And Dr. Weiner, we'll turn to you. Any final comments this evening?
Again, I'd like to express my appreciation for being invited tonight, and I hope that everybody in the audience found this informative. I would like to stress that even though we're in pandemic and hopefully coming out of it very soon, that should not be an excuse not to visit the doctor. I know at Jefferson, we do everything we can to ensure every patient's safety when they come to the office, and the offices are designed to maintain the ultimate in patient safety during this very trying time. And because of that, I would echo what Dr. Spielman mentioned, and that is, don't delay care. Don't deny yourself what you're trying to provide for everybody in your family. And even the smallest symptom may have a great amount of significance. That is something that trained medical professionals are there to help tease out what's important and what's not. It's important to have regular visits with your physician, appropriate blood testing, and again, maintain a healthy diet, do not smoke, minimize alcohol intake, and we're available if you need us. Thank you very much.
Well, thank you so much. What a wonderful message to end on. We really appreciate it, both Dr. Weiner and Dr. Spielman, for your time this evening. And again, as we close out this evening, we will be posting a website link that Jefferson is continuously updating with the latest information about the pandemic. We will also be posting a post-event survey so you can let us know your thoughts. Was this helpful? Is there another time that works better? Any other specialties you would like to hear from? Your feedback will help us bring more virtual events like this to you, the patients. And if there is anything anyone here at Jefferson can do for you in this time of need, please reach out to us. We will continue to offer wellness webinar series events. So please go ahead and keep checking jeffersonhealth.org for any upcoming patient events. We have webinars coming up over the next few weeks. On the screen, you can visit the URLs to find out more information about the events and go ahead and register there. And we have a recording of this event will be available on our website in the next week or so, so you will be able to rewatch. Thank you once again so much for joining us, and please be sure to stay safe and healthy. We look forward to seeing you soon. Thank you all.